Dr. David Farley, and with Dr. Nancy Perrier, we are friends and champions for Dr. John Van Heerden, who we are honored to introduce to you as a 2025 American College of Surgery icon in surgery. Dr. Van Heerden hails from South Africa and in 1965 arrived in Rochester, Minnesota, where he trained and subsequently worked at the Mayo Clinic for 30 years.
Dr. Van Heerden was a phenomenal general surgeon, academician, teacher, and leader. His Mayo team performed nearly 30,000 operations, published more than 500 manuscripts, and educated hundreds of trainees. We know Dr. Van Heerden to be a kind, thoughtful, insightful human being with an incredibly high set of standards and a tenacious work ethic. He's a true gentleman surgeon and has so much to offer each one of us. As the first ACS icon in surgery from South Africa, tell us, Dr. Van Heerden, about your early life and the pathway that led you to Rochester, Minnesota and the Mayo Clinic. Tell us about your parents.
I would love to, Nancy. We had a routine when I was somewhere between 12 and a half to 15 that once a month I had to go dancing with my parents. And I'd go there and there would be roughly maybe 12 people, 6 couples, and myself. And my duty was to dance with every one of the ladies and to be nice to them and to compliment them on 2 things. Because I knew on the drive back home, which was usually about 30 minutes, my dad especially would quiz me, what did you compliment her on? I realized after a while they were teaching me about life. And I think we don't have enough of that teaching today.
We love hearing those relationships that you have built so beautifully through the years. Tell us about your mentors.
So at age 15, I found myself at the University of Cape Town. I knew from a very early age I wanted to be a surgeon. The chief of surgery there was Professor Yanni Lowe. I remember the first day that he gave us a lecture. He was at the podium for about 30 seconds or maybe 45 when a light went on in my skull. I said, I want to be just like him. And I tried my very best to do just that. I had a lot of fun at medical school, and I realized I need to do a surgical residency. So I made an appointment to see my good friend, Alec Walt. Alec Walt was a senior consultant at the University of Cape Town, and I told him, I need your guidance. Where should I apply to be a specialist and do the kind of surgery that you do, Mr. Walt? And I remember him leaning back, and he said, no, wait a second, John. You belong at the Mayo Clinic. And I remember responding, but that's in America. And he said, aren't you a smart lad? He said, give me some time, let me make some calls. And that's how I became a resident at the Mayo Clinic. I worked, or had the pleasure of my second quarter working with Dr. John Kirkland. Just an amazing person. He went to Auckland to visit Sir Barrett Boys at the Auckland Clinic because Sir Boys was perfecting a new operation called aortic homografts. And lo and behold, we had a patient that needed that operation, and I had the privilege of being a second assistant in that operation. We all realized that morning that Dr. Kirkland was more uptight than usual. He was nervous, and that was clear. And the operation, I was assigned to holding 2 long retractors over the patient's left shoulder. I couldn't see a thing of what they were doing. The valve was replaced, patient went off bypass, and there was quite massive bleeding. He immediately went back on bypass, and fiddled around down there. I don't know what he did. Came off bypass, a repeat bleeding. And all of our heads were together, and he very quietly said, "Get Dwight." Dwight Magoon was one of his colleagues in cardiac surgery. He was the nicest man I have ever met in my life. Kindness personified. And while he was scrubbing in, which was in the operating room, he was effusively praising Dr. Kirkland. He said, "This is a monumental step in cardiac surgery, John. Wonderful. And I'm sure the patient's going to do just fine." And he quietly said to Dr. Kirkland, very apologetically, "Do you mind if I put a suture in?" Dr. Kirkland said, "Of course." And he took a suture, went down there, and I don't know where he put it, but his hands came out, the bleeding was gone. Patient came off bypass, and Dr. Kirkland said, "You can go now." And he thanked him, thank you for the privilege of being here," and he left the room. As soon as he had left the room, Dr. Kirkland went to the Mayo wash basin, washed his hands vigorously, I remember vigorously, and I could see he was angry. And he said, "Doggone that Dwight Magoon, nobody can be that nice. I bet he goes home and kicks their dog every night." I'll never forget that. And Dr. Magoon and I became great friends. What a wonderful time that was.
John, it must have been really energizing and engaging to work with such giants, and he wasn't the only giant there at the time. What can you tell us about working with Dr. James Priestley, the first surgeon to remove the entire pancreas and also a master gastric surgeon?
Yes. You know, I had the privilege of working with him for 3 quarters, David. I needed to do that because I saw a true artist in the art of surgery at work. Every day, Dr. Priestley ran 2 rooms every operating day. In the first room was truncal vagotomy and entrectomy, and the second patient was truncal vagotomy and entrectomy. In the other room was truncal vagotomy and entrectomy, and a hernia or a cholecystectomy. That was the limit. We didn't do more than 4 cases, so everybody could take their time. And before we started the first case, he came in. He said, "The patient all prepped?" "Yes, sir." He said, "Let me tell you one thing. We have these sponges. This sponge, John, never is free in the operating space. Do you understand?" "Yes, sir." Halfway through the attempted closure of a difficult scar duodenum, which Dr. Priestley was doing, he was doing the whole case, I was being the first assistant. My left hand was tied up, giving exposure of the duodenum. I had a sponge, and I knew I needed vascular pickups to pick up the sponge as I dropped it and go down into the depth of the wound. I dropped the sponge on the table, and before I could get the vascular forceps from the nurse, Dr. Priestley had taken the sponge, and he left the table and he went to where the waste bucket was, and he folded the sponge very carefully, and I could see the veins in his neck starting to get bigger. The operating room was silent. They were waiting for an outburst, and he folded this thing until it was just about nothing, and he then took it and he threw it in the waste paper basket. And he came back and he said, "Where were we?" Never castigated me. Not a single swear word came out of his mouth, but I never, ever in my life left a sponge unattended. David, he was an amazing man, both in and out of the operating room.
Indeed. Wow. Your career is amazing. What were watershed moments for you?
In 1967, On a Tuesday morning, I was working on the Judd service, Dr. Edward Judd. And he said, "Oh, John, before we make rounds, may I talk to you?" And he said, "Last night at Surgical Society, we made a mistake. And I've been asked to pick your brains because you come from a country and you grew up in the era of apartheid. And you grew up in a male-dominated society." I said, "Yes, sir, that is correct." He says, "Our staff wanted to know from you what you thought of our decision to appoint 2 ladies as chief residents." And he emphasized the ladies. "What do you think, John?" And I said, "Dr. Judd, I know both Margot Longo and Ethel Stackhouse very well. You will find that they will be 2 of the best chief residents you have ever had in the department." And just to show you how the world goes around correctly, I'll come to my time at MUSC, the Medical University of South Carolina, a little later on. But soon after I assumed some duties there, our class of interns were 6 females. I could never have been more proud.
Speaking of being proud, John, tell us a bit about your family.
I, with the help of Sheila, my wife, she produced the children, with a little bit of help from me, Lizette and Sue. Lizette is a professor of veterinary medicine and is a full professor at the College of Tulsa in Tulsa, Oklahoma. I love her to death. Our younger daughter, Sue, from an early age wanted to be an airline pilot. And we said, well, that's not going to work, because she hated school. She hated school. If she got a C+, she'd come home beaming. "I got a C+ today." It's better than a C-. Long story short today, her office today is the cockpit of a 777. She flies only 777s out of Los Angeles, only overseas to Australia, New Zealand, Shanghai, Tokyo, and sometimes for fun to London, England. I love those 2 ladies more than you can ever imagine. And you've met them and you know what wonderful ladies they are.
A lot of viewers are going to wonder a little bit about your surgical career. You have done nearly 30,000 operations, and that's mind-boggling to me and Nancy. How about giving us and our viewers some insights about what your operating room team was like and the actual teamwork it takes to consistently operate on 6 to 8 to 10 to 12 patients every surgical day for 30 years?
I am indebted more than I can ever appreciate to 2 people. The one is Rick Tuft, who started with me as a 20-year-old Vietnam vet. He was in Vietnam at age 19, leading a platoon. And the ritual that Rick and I had was as follows. We would introduce ourselves, and usually I would say to the patient, "How are you doing today, Mr. Jones?" And Mr. Jones would say, I'm so nervous. I've never had any surgery. Oh my God." And I would say, "You know, Mr. Jones, how do you think I feel? I've never done this operation. Today is the first day they're turning me loose to do this operation by myself with my whole team." And Rick would be the straight man, and he would lean over and he'd say, "He's done 3,000 of these operations." And the ice was broken. But we'd come to the operating room, the nurses, especially the circulating nurses, would be ready with warm blankets. They knew that was part of the ritual. The last piece of the ritual was that I would hold the patient's hand. To me, that was important. And I gained more from that than the patient did. But I was impressed over the years, David and Nancy, how many times patients would say to me, "You know how much it meant to me that you held my hand? I was so scared." So I think we should all do that little ritual. The second person to whom I'm indebted, and it's also an amazing story, was Dawn Miner. We would touch base in the morning, usually at the scrub sink where we were scrubbing together, and she would say, "Any long distance calls today, Dr. Van Heerden?" And by that she meant she could make local calls, and that would be talking to one of God's angels. But if there was a long distance call, she would dial up God directly, and she would ask for God's guidance. And I would say to her, I'd say, "Dawn, the third patient I'm worried about. This is a multiple re-op patient. It's going to be a big operation. It's going to be dangerous." At some stage of that third operation, she would appear in my line of sight. I didn't have to turn around or look where she was. She would look me in the eye, and with a small nod of the head, I knew she was talking to God at that time. And things went well. She was not only one of the most religious people that I have never ever known, and she helped me in that regard a lot. And she would chop down these huge trees into small pieces and take the firewood to the indigent and those who were housebound, the old people. And she was known as the tree lady. And one Saturday afternoon, she chopped down a huge tree, and the tree fell on her and killed her. I'm sure she was conscious for a little while she lay crushed on the ground. But I would like to think in those few lucid moments, she made a long distance call. And I know that that call was answered promptly.
You know, you taught hundreds of trainees, close to 35,000 patients. And then you left Minnesota. Tell us what you've done in retirement. It's a whole nother season of life. Talk to us about it.
So yes, I moved down because I'd had enough snow and enough cold. And I left there with some reticence because I was enjoying what I was doing every day. And Sheila and I drove down from Rochester to Seabrook Island, which is about 20 miles out of Charleston. And on Monday morning, the telephone rang. There was this high-pitched voice. "This is Dr. Fred Crawford. I'm the chairman of cardiac surgery at MUSC. Welcome to the Low Country." I said, "Dr. Crawford, how did you know I would be here?" He said, "Oh, all those boys who do the cardiac surgery up at Mayo, I trained them all. And they told me you were coming down, and they told me there were some special things about you. So I'd like to welcome you to our department. You are joining our department." I said, "Dr. Crawford, I've been retired for less than 2 days." He said, "Don't you understand, English boy? You are joining our department. I want you to come and help teach these youngsters about endocrine surgery." He said, "There's only one hitch. We don't have any money. Are you still interested in doing that?" I said, "Of course, Dr. Crawford." That started my relationship with Dr. Crawford, with Dr. David Cole, who is currently the president of MUSC, and with Dr. David Adams, a true Renaissance man.
John, you've had an amazing surgical career with such a diversity of experiences, and you've seen just about everything this fragile world has had to offer you for 87 years. What words of wisdom would you like to pass on to the viewers of this interview?
David, I think we have lost the art of listening. We don't listen to each other, and we need to do that. Dr. Charlie Mayo once said, "If I talk, I don't learn anything. But if I listen, surely I will. I like to keep that mantra in my mind.
I tell you, people throw a pebble in the pond and the ripples extend for a long way. You've thrown a boulder, my friend, into the pond of life and the pond of surgical education, and those ripples will last centuries, last generations, because Farley and Perrier and everybody coming behind us are using your magic. Thank you very much for what you've done for us, for your patients, for your family. Just phenomenal career, John. Thank you so much.
David, thank you. You are so eloquent. And the greatest joy, after all, is two things. Number one is to make a sick patient or a hurting patient better. There's no bigger reward. And the second is to be involved in the training and realize you have created something that is probably, if not as good as you are, but maybe somewhat better.
Where does it all come from, John? Where is the mystery, magical sauce? Where is that fortitude of service that emanates from you? Where does it come from, and how did you foster it?
David, that's an easy question to answer. It comes from my mom and dad, who, when I had 2 more years of high school to finish in Rustenburg, my dad, who worked for Barclays Bank, was transferred down to Cape Town. And my mom and dad decided in their wisdom that I should not accompany them. I should stay with some close friends of theirs in Rustenburg. Every Sunday night, my parents would call, and first would be my dad. And my dad would want to know about the grades, what's hard, what's easy. And then we would end up with my mom, and my mom called me Jaunty. And she was a great mom. And she would say, Jaunty, are you getting enough to eat? Yes, Mom. She would say, Jaunty, are you warm, my son? I said, yes, Mom. She said, are your clothes nicely ironed and always neat? Yes, Mom. And she'd hesitate, and I knew it was coming because I knew I would start crying. And she would say, yes, but Jaunty, are you happy, my boy? Yes, Mom.